psoriasis is. Layman terms, you know, or have you seen those with people who have like red, patchy skin? Essentially, that is what psoriasis is. But don't exactly take my word by word, because
we're not the experts.
We're not the experts on the set. We do have an expert. However, we have Dr Nazirin Ariffin, consultant dermatologist from Pantai Hospital, Kuala Lumpur.
Welcome, doctor.
Thank you for inviting me to this show.
Thank you.
You're welcome. Thank you so much.
We kind of gave a little bit of a definition, but that is our layman understanding of the condition. Can you give us the proper, politically correct definition?
Correct. Psoriasis is a common chronic skin condition which characteristically manifests as patches, as you rightly commented, red or pink patches on the skin with some scaliness. Usually the patches are slightly elevated from the surface of the skin. It can occur anywhere on the body, scalp, face, the trunk, limbs. It can also develop on the nails and also can involve the joints as well. We call it psoriatic arthropathy or psoriatic arthritis. It is a common condition. 1 in 50 people have this condition. Male and female equally affected by this disease.
So the scary thing for me is you just mentioned common and chronic in the same sentence.
Yes.
And Googling psoriasis, I found the word autoimmune, which is scary because the only other autoimmune disease you know about is HIV and AIDS. So can you help us debunk some of the myths or really put into perspective what all this means?
HIV and AIDS is problem with the immune system. There's lowering of part of the immune system, whereby autoimmune is the imbalance of the immune system. So there is a big difference there. Okay. So HIV AIDS is infection, and psoriasis is not an infection. It's a skin disease.
Right.
Okay. It's chronic because there's no cure for it. Okay. It's a long term. It waxes and wanes, but we do have very rarely some people who actually just clear their psoriasis long term. But that's quite rare. But we do have certain people who actually clear their psoriasis.
Rare, do you have a rough estimation or a rough calculation? What is rare? You mean forever and ever?
Forever and ever, but that's rare as in rare. There's no percentage of that. No percentage.
Sorry, with HIV you said it's an infection. And with psoriasis you use the term skin disease.
It's an autoimmune. You're talking about autoimmune, whereby there's an imbalance within the immune system itself, because our immune system is very complex. Okay, so when there's an imbalance, you can have psoriasis, certain skin condition like lupus, dermatomyositis, and what have you. These are categorized as immune modulated. And even some not just skin problem, but some other internal problem like inflammatory bowel disease, etc. Rheumatoid arthritis. They are all categorized under autoimmune disease.
So the question would be: is it infectious? Can it spread from person to person, or is it something contained within the individual themselves?
It's not infectious. So you can't really spread from one person to the other. But if you have genetic predisposition to have that, for instance, if it runs in the family, if one of your family members have it, then you have a higher chance of developing psoriasis.
So it is hereditary as well, right?
But the hereditary factor associated with this is quite complex. The genetic background of psoriasis is quite complex, and it involves multiple genes, which we don't fully understand currently.
Okay, so let's get back to basics. You talked about how psoriasis can affect people differently. I have a friend who only has psoriasis on her scalp, and another friend who has psoriasis all over her body. My question is to you, why is it different for different individual?
we do have different types of psoriasis. Yeah, we do have the what we call a stable plaque psoriasis, where usually involves the flexural areas. Flexural means the elbows, the knees, sometimes on the scalp, the ears as well. We do have different type of psoriasis where it just involves the hands and feet. We call it palmo-plantar. Palmo means palms, plantar feet, yeah, palmo-plantar psoriasis. You have the gutted psoriasis where you have, gutted means like raindrops. Yeah, little small plaques all over the skin. That can be associated with an infection called streptococcal throat infection. Okay, yeah, it's a bacterial infection. There's also pustular psoriasis where you have within the plaque psoriasis you have little tiny vesicles, fluid filled with pus. Vesicles filled with pus scattered all over the body. Yeah, and also the last one is erythrodermic psoriasis. Yeah, that is associated with redness, which can involve 70-75% of the body surface area. That can be quite a problem to the patient because they can suffer significantly.
And how does one treat psoriasis? Because for my friend who has the scalp problem, she uses a medicated shampoo. But for those who have a more, like you said, more severe case of psoriasis, is there any cream? What can they do? Do they avoid the sun?
There are different types of treatment depending on how much of the body involvement, what type of psoriasis, and also the personal circumstances. Okay, for instance, if it's a small plaque psoriasis, the stable plaque psoriasis, and it's just scattered on certain areas of the skin, you can use cream, lotion, ointment, that kind of thing, just a topical application on the skin. Whereas if you have moderate to severe, you may have to go for something called light therapy. Light therapy, tablets, or even injections. Okay, with light therapy, you have to be committed because you need to actually go for 2 to 3 times in what we call the light box. It's like Doctor Who. I don't know whether you see the program Doctor Who. It's a British program. You go in there, you sit in there for a couple of minutes. It shine a certain type of light, UVB, narrowband UVB light, or the other one is PUVA, UVA light. But with UVA light, you have to either take a tablet called Sorolin or have a Sorolin bath prior to going into the light box.
Wow. So individuals with psoriasis have different management techniques and treatments available to help them with their condition. How do they get diagnosed in the first place?
Usually it's clinical diagnosis. We rarely do biopsy. Clinical meaning how the psoriasis looks like.
Right.
Yeah. We only do biopsy if we doubt our diagnosis. For instance, if we've asked the patient to use the certain product or take the certain medication and they don't respond, we need to actually double check by making sure that they are compliant with the medication in the first place. And if they are compliant, then if it doesn't work, then we need to actually make sure that the diagnosis that we arrive to is a correct one.
Okay. Do you have, let's say, because for example, my parents were not very big on normal medicine. We try to go like the natural route. In your recommendation, any natural remedies that our audiences could possibly try?
Well, I'm a modern medical doctor.
Is it advisable to go for like a traditional remedy if you have psoriasis or if you suspect you have psoriasis?
Because I don't have much experience at all with regards to traditional medicine and herbal medication, I will not be able to advise. The thing about modern medicine is we do have the full list of ingredients. It's been trial and tested extensively before it's being distributed to the public. Whereas some of the traditional or herbal medication do have certain contents that we don't know, or even the practitioner who does the traditional medicine doesn't purely understand. So it's I can't comment on that. Certain herbal medication, particularly those which are ingested. Yeah, you just have to be careful, because if it contains a steroid and you're taking it by mouth, in the herbal medication, you may exacerbate the psoriasis after you try and stop the medication. So we do see patients who, whilst trying to stop oral steroid or certain herbal medication that contains steroid, they have a big flare-up following that.
Okay, there you go.
When we interact with individuals who have psoriasis, there is some stigma because we notice some deformed skin conditions or patches, and we're apprehensible about dealing with them. What's your advice to the general public when individuals with psoriasis interact with them on a daily basis?
For the person who actually interacts with somebody who has psoriasis, you have to have empathy towards them, because they do suffer from the psoriasis themselves. It is sometimes painful, sometimes itchy. Painful when it's on the hands and feet. They have sometimes trouble of walking, and sometimes they have difficulty trying to do their everyday chores. They themselves, as patients, have lower self-esteem, anxiety, depression, particularly if the psoriasis is shown on the exposed areas. So we as public should not, compound the problem. Is it contagious? Well, it is not contagious, and they shouldn't be worrying about getting or catching this disease from that particular person.